Good evening. Welcome to tonight's program. I'm Kelly Wright, and I hope you enjoyed a great weekend. And here we are at the start of a new week, and yet dealing with the same old problem. It's known as coronavirus, this COVID-19 global pandemic that continues to disrupt our lives. Yet the President of the United States announced on Friday that he would like to see some states reopen and has started asking those state governors to actually move towards that reopening. Now, one state in particular is Texas. Tonight, we're going to be speaking with a doctor from Texas, from Houston to be exact, who will talk about the reopening of that state. You might be surprised by some of the things that he will say. Also, in the midst of the reopening of some states, there are quite a few people who are indifferent about it and quite concerned about it because they're looking at the numbers of the total number of deaths here in the United States, which is now reaching more than 40,600 people dying from the coronavirus. Throughout the United States, more than 759,000 people have tested positive for it. And there are 70,000 plus survivors of the coronavirus. So this is causing some people to have some mental anxiety, as you can imagine, being under stay-at-home orders. People have taken to the streets to protest, wanting their freedoms to get back to the jobs, to get back to employment. And yet at the same time, there are people who are becoming depressed with this high anxiety that we're all sometimes experiencing. So we'll talk to a couple of people today who will try to help alleviate some of the stress and give you some factors on how to overcome it. And here's the bottom line. As we continue to deal with this, we must all realize that we are in this together. So we have to keep lifting each other up, not tearing each other down. We can get through this. It will take us doing it together. And those are my opening observations. Joining me now is my next guest, Dr. Robin Armstrong. And of course, he's been on this program before, weighing in on all that pertains to the COVID-19 pandemic and its impact on Houston, the Houston, Texas area. And Dr. Armstrong, so far, Houston has fared well. Can you give us an update on what's going on there?
Yeah, we have. We have in Texas and we have in the Houston area. We've got a little bit of an uptick in cases in the Houston area, but for the most part, we've done well. In fact, our governor actually did a press conference today that next week we'll start opening up retail stores and start opening up things with some guidelines for safe distancing and all that. But open up movie theaters and retail stores and stuff. And so we're getting things open again here in Texas. So we're very excited. We think that we have, Texans have, we don't have a mass transit system. We have, buses for sure, but we don't have the subway system that some of these other folks have. And so we like our yards and we like our vehicles. And so yeah. I think that we generally are pretty spaced out well. And so, So we actually have fared fairly well, and so we're happy about that. And just praying for our brethren across the country.
What concerns do you have in rolling out the return to a different state of normalcy, and that people will be able to have their freedoms in Texas? Do you have any concerns at all that it might be premature, or do you feel reasonably sure that you will not see a spike or an uptick in the coronavirus out there?
Well, I think that this is probably a good time. I think that this is probably about as good a time as any. I think at some point, I think we're going to have to start opening some things up because it's just devastating from a health perspective and from a financial perspective. When people aren't able to go to work, it can have devastating health consequences as well. And so it's very difficult to strike a balance with the public health concern and with the economic concern. But I think it's a good balance.
So, Doc, will people do it in a phase? Are there different phases of this reopening of Texas? And what I mean by that, will they have to wear masks where they go, or what's the parameters involved here?
Well, at this time, there'll still be an expectation of kind of safe distancing. And so even in restaurants or retail stores, you'll still be expected to kind of keep your distance, and we'll still use all the same practices that we're using today. And certainly there are going to be a lot of folks that are going to wear masks still. It's not necessarily a requirement, but there'll be a lot of folks still doing that, just because I think people will want to be cautious themselves. And I think generally people are pretty smart, and people are pretty prudent, and for the most part, people make the right decisions to protect themselves and their families. And I think that everyone is on the same page about how serious a condition this pandemic was. And so I think everyone understands that, we just need to be very wise, very prudent, continue the same practices we're doing, but allow those small businesses to open up and begin to, kind of do what they do, serve the public and bring joy to all of us, with our Texas food. And so we're excited about getting them opened up, and I think that we'll do well. I think we'll do well.
Final question: what are your concerns about, or what's your advice rather to people who have compromised immune systems and the health disparities that exist within the African American community as well as the Latino community, given the fact that there's this respiratory illness, diabetes, hypertension, heart disease that runs so rampantly or adversely in the African American community as well as the Latino communities?
Sure, that's a great question. I think for immunocompromised folks, I think they should continue to kind of shelter in place for a while. For those that are most vulnerable with chronic medical conditions and medical problems, the elderly especially, I think that those folks should still but be very guarded about going out. They should still continue to practice the same practices we have been, staying at home, staying sheltered for now. I think it's going to be very important for those folks who are most vulnerable to continue to do that. For the healthy population, though, I think it is reasonable to have them go out and start working again. Yeah. And so I think that's going to be good for everybody. And it's ultimately going to be good for those elderly folks as well. I think if we can put people back to work, it's going to help, control those the diabetics and control the hypertension. And so they'll be able to purchase their medications and such. And so I think it's going to be a good balance for all. We're excited to see and kind of put it to work. I think it's going to be a great opportunity for us to really lead the nation in getting America and getting Texas back to work. And so we'll be an example of how it should be done.
Dr. Robin Armstrong weighing in on how Texas is reopening. And of course, we appreciate you being on the program, sir. You're an internist and hospitalist there in the Houston area. And thank you for being on the program today.
Yes, sir. Thank you very much.
And we'll be back with more after this. Welcome back to the program. So I'm joined by my great guest, Dr. Cheyenne Bryant. She is a psychology expert and life coach. And Dr. Bryant, it's always good of you to join us. I was just talking real quickly to Supervisor Mark Ridley Thomas there in Los Angeles. And we were talking about a myriad of issues that are confronting the people of Los Angeles related to COVID-19. And one of the things that he talked about that we did not air was the fact that he was concerned about the mental health of people, not only there in LA and California, but around the world. At this time of high anxiety, Dr. Bryant, what's your advice in terms of being a psychology expert and a life coach?
Absolutely. And, I love Mark. That's a good friend of mine. And that mental health is a great concern because, 1 out of 5 Americans experience a mental health condition. 1 out of 2 Americans are at risk for developing a mental health condition. This is prior to the pandemic. So now that we have crisis and pandemic, those numbers have definitely skyrocketed. In Los Angeles County, the main concern with a lot of the people are that the normal medical protocol, the normal doctor office, the normal hospital protocols will be disrupted or no longer available for them because they know that the care for the COVID-19 individuals are extremely intensified. And so people are afraid that, hey, if I have a mental health breakdown, right, and I do happen to call 911, or if I do go into an emergency room, will I be able to get the care that I need? Being that they have, COVID-19 patients that are really needing that care. In addition to that, when you're dealing with first responders and the healthcare providers, they actually experience something called secondary traumatic stress, which is when you are exposed to any type of trauma that is indirectly happening to you. So with them being in these hospitals and them having to deal with all these patients who are experiencing so much trauma, they are also becoming secondarily traumatically distressed from that. And so them themselves have to make sure that they are taking care of self and that they're making sure that their mental health is in a place of stability so that they can not only be good for their patients, but be able to be emotionally available and stable for their families.
That makes so much sense because those doctors and nurses and healthcare workers, some of them are staying away from their families, afraid to go and meet with their families for the fear of spreading COVID-19 without even realizing it. I'm going to get to something else that you're doing. You provide a lot of life coaching for people online, but your foundation is doing something. You've raised something like $100,000. Can you tell me what's going on with your foundation and how you're meeting the needs of so many people, Doc?
Absolutely. Kelly, we have a really good friend by the name of Mike Lansing, and he's out of the Harvard area. And he contributed $100,000 worth of grocery gift cards to the Dr. Bryant Foundation. And we are providing that to the families that are in the low income area, who don't have access to food, and churches. We're providing it to different organizations that need this. In addition to that, Mike also has donated hot meals. We call it a hot meal grab and go. So that we at the Dr. Bryant Foundation, in conjunction with NAACP, because I'm president of the NAACP for San Pedro Wilmington, so that we can feed 100 families. Now, we're not feeding 100 people, we're feeding 100 families. The entire household is going to be provided with hot meals. It's something that's absolutely amazing, and we're very grateful to be able to be a part of it in that capacity.
Well, I'm very grateful for the great work you're doing out there. And, you're always welcome here on this show. I love having you on and providing a lot of uplift for people. And certainly your foundation is doing that. And certainly you're doing that in your capacity as a psychology expert and life coach. So to all of the wonderful people out there in California, keep on keeping on. Don't stop. Don't stop. They need it. Because Mark was telling me that some of the places in California will likely remain shut down until foreseeably 2021, next year.
Yeah, that is something that our mayor has spoke about, saying that when it does reopen in 2021, if it's not 2022, then the restaurant sector will have to wear gloves, and they will also wear masks, and that we will continue this PPE protected wear, protecting ourselves and others until we are really confident that this virus has stopped coming in and attempting to really kick our butt. But I want to tell people, just to, in the midst of trying to stay optimistic, to really take, really start to reach out to your resources. There is a Christ Text Center that if you text just the word home to 741-741, they'll text you back and with assistance and support, Kelly. My COVID-19 free group life coaching session. We do it every Monday, 6 p.m. Pacific Standard Time via Zoom, and it's free. And it's just to support those who are under distress and anxiety like we're talking about, and give them a safe haven, a safe space to come in and say, this is what I'm going through. And it feels good to know that I'm not alone. And I'm providing support. Yeah. So just reach out to your resources. You don't have to be alone out there, because mental health individuals have a tendency to isolate anyways. Yeah. And we don't want that. We don't want that.
Dr. Cheyenne Bryant, good of you to be on. And you know what, as you're talking, we're going to have a panel discussion with you and some of your colleagues so we can talk about the mental health aspects of how it's impacting the United States and people around the globe, and how we can really help each other even in the midst of this social and physical distancing of ourselves. Yet we should never isolate ourselves from being able to help somebody. So let's plan on doing that and having it right here in the program, hopefully sometime next week.
Yeah, I look forward to it, Kelly. I would love to, and I love what you're doing. So count me in as being a part of it whenever you insist.
All right, appreciate you. Dr. Cheyenne Bryant, psychology expert and life coach on the Kelly Wright Show. We'll be back with more after this. Welcome back. My next guest who's joining me now is Jackie Flynn. She is the executive director of the A. Philip Randolph Institute there in San Francisco. And Jackie, welcome to the program. It's a delight to actually have you.
Thank you for having me. I'm happy to be here.
Well, thank you. I hope you're faring well in the lockdown situation in the state of California as it pertains to the COVID-19 pandemic. But you're also kind of hampered or hamstrung, if you will, in trying to get people to take the census, the all-important census. Can you tell us what kind of difficulties you face and how you're overcoming that to encourage people there in the San Francisco Bay Area to make sure that they sign up with the census?
Yeah, well, with the shelter in place, we think that's an important measure right now that is going to protect our communities. And so one of the things we know is the old school methods of going door to door, which we're really experts at, we have to adjust. And because the census this year is primarily done online, although they have sent out paper surveys, we know that our community has a significant digital divide that, from access to hardware, to internet service, to knowing how to respond. These are all the challenges that we're facing right now. So what our organization has done is, we've heavily relied on our telephones and our social networks. And, instead of doing door to door, which we're still waiting to find out whether or not we can do that in the upcoming months, we're relying on phone banking and social media. Those are the best methods right now. And we're fortunate that we established a social network prior to the shelter in place.
It's so important, and beyond the scope of making sure that you encourage people to take the census, even those who are hard to reach because of the digital divide that exists. What else does the A. Philip Randolph Institute do, particularly in the midst of this coronavirus pandemic?
Well, we are one of the workforce development service providers in the neighborhood that we serve. We are in a primarily African-American neighborhood in San Francisco in the Southeast. It's Bayview Hunters Point. And we're very proud to be in this neighborhood, but this neighborhood does have some significant challenges, especially just with sheer education about what's going on with the impact of COVID-19. What's been great in the neighborhood is we've had folks with all kind of rapid responses like food banks, and making sure that our community still has safety measures in place, because just imagine we've had hundreds of people in line at food banks that need protective equipment to stay safe. And so our organization has continued to communicate messages that we get from the city about what our next policy measures are that we take, what can we do to stay safe, as well as partnering with organizations to make sure that there are masks available at these food bank giveaway, and the message is going out to the community that these resources are available. One of the other things that the A. Philip Randolph Institute in San Francisco is working on is how do we address this digital divide? Because right now we're heavily relying on resources like Zoom conference, right? And a lot of people just kind of take advantage of the fact that they can pick up their phone and they know how to use it. Well, for folks that haven't had an iPhone in their home or a laptop or computer, that can be very challenging. And so we want to make sure that we provide a resource where people can get information and education. And we've been using our phones because that's one of the most effective ways to communicate right now.
Absolutely, using it as a tool. And Jackie, I just want to thank you for representing the A. Philip Randolph Institute. And a lot of people may have forgotten that A. Philip Randolph is one of the pioneering civil rights leaders of our time. And I just want to read a quote from him real quick. "A community is democratic only when the humblest and weakest person can enjoy the highest civil, economic, and social rights that the biggest and most powerful possess." And you, my friend, are certainly in the forefront of making sure that his legacy continues. So I appreciate you for being on the program today and not only sharing the insights of what's happening with the census, but also the outreach that the A. Philip Randolph Institute is doing and committed to helping people, even in the midst of the COVID-19 pandemic. Thank you.
Thank you so much for having me.
Good to have you back. We'll be having you back, I'm sure, again. I'm Kelly Wright. We're coming back with much more after this. So welcome back to the Kelly Wright Show. Joining me right now are two guests from Nigeria, and they are going to explain to me what's going on and how the COVID-19 pandemic has affected them in Nigeria. Joining me is, he's an attorney and a pastor, Wemi Webele, and his wife, who is a doctor, Yvonne Webele. Thank you both for joining us today and weighing in on what's happening with the COVID-19 pandemic. Pastor and lawyer Wemi Webele, how has this impacted your church community and your law practice?
Well, thank you, Kelly, for having us. Statistically today, we have, what's the number of cases in Nigeria now?
442.
442 cases in Nigeria confirmed. Yes, we have a partial lockdown in Nigeria right now. But Rivers State, where we're beaming from, we don't have a full lockdown. We have about a congregation of 50 churches per time, 50 persons per time. So we have a partial lockdown for the churches, 50 persons per time, recognizing the social distancing.
Okay, so you're recognizing that in order to protect everybody, and your 50 people are able to come into the church or another assembly at any given time. Do they have to keep a certain distance from each other while they're attending church?
Oh, sure. What's the meters?
1.5.
1.5 meters distancing.
The seats are spaced.
The seats are spaced.
Okay.
Widely, yes.
And your law practice, are you still able to operate and function with your law practice in the midst of this coronavirus?
Kelly, the entire judicial system in Nigeria is shut down right now.
Wow.
Shut down. We're all working from home, but you know what it is to work from home when you are self-employed. It's pretty difficult. She is working because she belongs in the essential practice.
Right.
But we totally shut down.
And Dr. Yvonne, so I understand that you're still working. You are an eye doctor, is that correct?
Yes, I am.
And
that's right.
The clinic that you operate, what are you able to do? What can you do and can't do because of the coronavirus?
Okay, we're doing more of emergency services. People come in if they have situations that cannot be handled, they cannot keep themselves back, so we attend to them. So we have some of our staff coming in, one or two of the doctors on the front desk. So when they come in, we treat them, but we make sure we put on our PPEs, the nose mask. We try to wear our clinical jackets. We also try to screen them before they come in. We have somebody at the gate with the sanitizers, and we have what we use to check their temperatures before they come in. So we try to avoid infections through that. But we're running a skeletal service right now because we still have emergency calls and all that, people trying to come in. But the patient's outflow has actually reduced drastically.
Yeah, sure.
You're watching The Kelly Wright Show. We'll be back with more after this. One of the things I wanted to ask you, Doctor, is your colleagues in the medical community, those who are perhaps working in the hospitals and seeing patients to test them. Do you have enough testing there in Nigeria?
Okay, like you said, we stay in River State, a different state, but we have most of the cases right now in Lagos, Lagos State and Abuja. So you have most of the testing going on there. They have centers that are well equipped with testers. So people come in and they get tested, and the ones that are positive are taken to centers, isolation centers, and they get treated. In fact, as of today, I think they've discharged about 152 cases have been discharged from the isolation centers.
And Lagos is your largest city in Nigeria. Nigeria is one of the largest countries, population-wise, there in West Africa. I'm just curious with both of you. Both of you have a daughter here in America who's attending college in San Francisco. Your communications with her, how have your communications gone with her, knowing that she's in a lockdown state and really can't leave her home? How is she coping with this?
Okay, we try to call her every day. Yeah, we call like twice a day. We do FaceTime calls, so we have that personal touch with her. We talk to her at times she gets overwhelmed with schoolwork, and we try to calm her down, talk to her, make her laugh, and make her know that everything is okay.
Yes, I said, if you want me to talk to you this time about Danielle, I will talk to you as a Christian, because we are persuaded that we are secured in Christ Jesus. He's given us assurance that no evil shall befall us, neither shall any plague come near our dwelling. So we're quite persuaded that she's safe and she's secure, and that the eyes of the Almighty is upon her and all that dwell in the U.S. In fact, we pray a lot for the U.S. because we hear the volume of casualties, and it's painful. It's painful. We pray every day. On Sunday, we spend quite some time praying for you guys over there, because we don't have too much recorded deaths. Not in our cities. We don't even have a death, not one case here in the States here. So we're safe. We're safe.
Well, that's reassuring, but it's also comforting to know that our friends in Nigeria are praying for America. And as you know, and by watching the news, or maybe you're not aware of it, is how devastating the coronavirus has been to African Americans because of the number of health disparities that we have here with regard to respiratory illnesses, heart disease, hypertension, and diabetes. It's really caused quite a bit of havoc within our community. So I appreciate you praying for us and reaching out to us throughout the diaspora.
That's a privilege. It's a privilege.
I want to thank you both for joining me from Nigeria. And what state of Nigeria are you in again?
River State, Port Harcourt.
Well, I love Africa, and I love the fact that you were able to share with us tonight. And to your daughter, Daniela, who is over in San Francisco, you guys have, from continent to continent, you're still reaching out and showing a lot of love. And I appreciate the love and that you're showing to those of us living here in the United States of America. Certainly we have we have a lot to deal with because we're leading the world in the number of deaths from this coronavirus. So I ask that you continue to keep us in prayer, pastor and lawyer and doctor. Thank you both for joining us.
Thank you for having us. God bless you.
God bless you too. And the show will continue right after this. Welcome back to the program. I'm talking to Dr. Ryan Merricks. He is the head of the Merricks Institute, a plastic surgeon from Miami, Florida. And you can see from the view right there that he's enjoying himself, but at the same time, he's hard at work. Doc, I wanted to ask you what's happening right now in terms of your reaching out to help your colleagues who are on the front lines of this global pandemic of COVID-19. And I'm speaking about those healthcare workers who are in the hospitals dealing with people who have the coronavirus, and they're still trying to protect themselves as well.
So all of us have pretty much made ourselves available if the need should come for backup help, as well as listed supplies that we could possibly contribute if needed. Luckily, things have gotten not been to the point where they're out of hand, to the point that they're calling upon most of these offerings. In the meantime, what everyone has done, it's mandatorily, we've shut down elective surgery, so there's no pool of resources away from hospitals that might need that. Now, there is some development. So my medical suppliers have sent me kind of rationed amounts based on my monthly use in my operating room of what supplies I can use. So that signals that everyone has on their radar getting back to work and maintaining these relationships for going back to normal business. We haven't yet. But the really exciting news today is that the American College of Surgeons released a statement on resuming elective surgery and what that entails and what we have to think about. So just today was released how we're gonna proceed and the considerations. And mostly what they're talking about is situational awareness. So we want to make sure that in the location that we practice, COVID is contained and manageable before we get back to elective services. So this just signals to us that everyone's thinking and focused on getting back to work, which I'm actually surprised a little earlier than I expected it. So not much has changed as far as operationally what we're doing, but I think that for the most part, at least in my area, we're relatively pleasantly surprised to see what's going on as far as progress and how things are moving along.
You know, when we talked a while back, about 3 weeks ago, to be exact, when the COVID-19 pandemic was actually, and still is, raising its ugly head throughout the United States, you had talked about that the way things were back then, it could be ruinous to a medical practice. Are you seeing that still holds true because of COVID's disruption of the economy and even medical practices like your own, or are you seeing that there might be a turnaround ahead?
Somewhere in between. So the American Society of Plastic Surgery has, ASPS has released a bunch of webinars helping to guide solar practitioners and giving them information about what they can do to transition out of solar practice, because the society, as well as most of us, anticipate a lot of people will not be able to survive this slowdown. And there's not an exact idea of when we'll be back to operating, and we're going to do things differently. So practice that rely on high volumes may be in trouble. And then solo practitioners that were maybe not on the most solid business track before are probably not going to pull through this. Just through all businesses, all types of business, there's going to be a percentage of people that cannot pull through this. We've seen yoga studios permanently closed. A lot of group fitness businesses are permanently closing, restaurants. But the really strong ones, they're going to survive it and come back. And we'll see some turnaround. I'm not going anywhere. Most of my colleagues that I know well are not going anywhere, but there will be some practices that either close down or regroup or join other practices. A lot of solar practitioners will look at trying to get hospital jobs or maybe into academics and things like that. So there's going to be a climate change, and it's evolving.
Dr. Ryan Merricks, we appreciate you sharing your insights into the terms of what's going on within the medical community, particularly with regard to specialists like yourself who deal quite a bit and rely on a lot of people for elective surgeries. I appreciate your insights, sir, and you're always welcome to the program. Thanks for joining us today.
Thank you.
Back with more after this. You might be asking, why am I laughing? It's because I'm all about empowering people and inspiring people to be successful. And no one does that better than my next guest, A.D. Roberts. He is a success coach out of Jacksonville, Florida. A.D., good of you to join me today. And in this heightened sense of dread and despair that so many people are feeling because of the reality of COVID-19, how do you keep people inspired to keep looking upward and onward, realizing they've got a pandemic to deal with in front of them?
Well, the biggest thing is people have to understand that what they're experiencing is normal. You know, stress, anxiety, it comes from when life changes and, you know, things shift in our space and we're not accustomed to that shift yet. Right. So, you know, that distance between where we were and where we are now, there's a tension that pulls, and we call that tension stress. And so one of the ways that I have been working with my clients and doing webinars and helping people navigate this time is really, the first thing is to just get folks to accept where we are. You know, there are just some things that you have no control over. And I know that's tough for many of us, but there are just certain things you just don't have control over, and you can accept them. And once you can accept where we are in this moment, if you can handle the next 10 minutes, you'll be fine. Then you deal with the next 10 minutes after that. You know, so that's just a simple, you know, the simple beginning of handling this situation.
Yeah, I find that it's a mental and even a spiritual attitude. And I think one of the things that I've been trying to do, AD, in my own personal life is I get up in the morning, I pray and make a devotional, and then I exercise. Absolutely. You know, exercise done because I have to stay home, but I make sure I exercise. And then I find that my mind is taking time out to think about what lies ahead of me. Now, that's for me personally. But there are other people out there in dire straits, man, who just really can't see the light of day because of all the darkness that's overwhelming them. They might have someone who is dealing with COVID-19. They might have lost someone. How do you tell them that even in the midst of their grief, that they're still capable of seeing not only a glimmer of hope, but to watch that glimmer of hope spread and expand in their life?
Everything, you know, anybody who's heard me talk, you know, I always share that everything in this universe vibrates. Everything has a vibration, and to that vibration, it has a feeling. So when we're feeling good, our vibrations are really high. You know, everything's peachy and cream. You know, but when we're not feeling so low, that vibrational frequency is low too. So if you can begin to look at your life and how you engage yourself and others from a vibrational perspective, the question is for you is, do I want to feel good, or do I not want to feel good? So how can I feel better, AD? What are some of the things that I can do to feel better? One is accept, you know, where we are. Number two, like you were saying, you gotta, there are 4 areas that I like to address when it comes to this stuff. There's the mental, the physical, the spiritual, and the communal. And if you can have touch points on each one of those 4 areas, I think you'll begin to see a shift. So like Try to do your best, stay positive as you can. Listen to some good music. Turn some Earth, Wind, and Fire on. Those, that music has a vibration, and that vibration being higher, it will help modulate your vibration and make you feel better, make you feel good. The physical thing, you got to get outside. So if you're in one of those places where you can get some exercise, go do it. If you can't come outside, do some moving around inside. You got to get that blood pumping. You got to keep moving, and that raises that vibrational frequency. The spiritual aspect, I don't know, it doesn't matter what your spiritual tradition is, but as long as you can get by yourself sometimes and just be quiet enough to listen, there's a voice that will speak to you that will encourage and empower. And if that voice is not a negative one, just simply tell it to be quiet and I'll wait on the next one. If it doesn't feel good, then it's not the right one. And then, lastly, communally, there's an interesting idea out here that we're talking about social distancing. I don't necessarily like that word. It's not a social distancing; it's a physical distancing.
Physical distancing.
So with the where we are, stay connected. Like how we're talking now. We're hundreds and hundreds of miles away from each other, but we're able to do this. We're able to have a conversation through Zoom. So there's so many platforms and things and ways that you can connect to your tribe. Stay connected to your tribe. Don't be alone. Hey, create a ritual every day when you talk to somebody or talk to a few friends. These are simple ways, simple things that you can employ to really make yourself feel better in this season.
Hey, man, I appreciate you for what you do, and always feel free to come back on and inspire us and keep us lifted up, because
absolutely,
certainly we can keep looking at the down and the negative turns, but if we keep opening up that aperture on hope, boy, hope prevails.
Hope always prevails, always. I'll say this, and I'll be out. In the presence of light, darkness can never prevail. So all we have to do is just keep that light burning, man, and all this darkness and negativity and low vibrational stuff, they got to get out of the way. It does. I really appreciate what you're doing, man. Empowering people, motivating folks, and helping to push them beyond this season. Thank you.
Oh, thank you, man. From the heart. God bless you, AD.
Thanks, man.
All right. We'll be back with more of the Kelly Wright Show after this. Welcome back, and now for my final word. Hopefully you've seen throughout this program today that there are certain steps that we can take to reduce the levels of anxiety and stress that we're experiencing from just going through this new normal of COVID-19. This is quite a pandemic that is disrupting each and every one of us. But here's a couple of extra tips that we can go by. We can set goals for our day, such as what time we're going to wake up, what time we're going to go to bed. Also, as I've often stated, we can exercise and get out and walk a little bit, but make sure you wear your mask. Another thing that we can do in this age of social and physical distancing is not isolate ourselves, but pick up the phone and call a friend, call a family member, and enjoy your time of encouraging each other. And finally, my friends, hopefully you've been united, and ignited to spread, not fear, but drop some knowledge on each other and continue to spread love, freedom, and peace. Peace out.
Mankind won't survive if our hearts beat inside a hateful rhythm. You see, love isn't bought, but comes with a price of forgiveness. And we all bleed the same. You don't feel the groove is out.